Hi, I'm Dr. Sarah Crawford with Wave Physical Therapy and Pilates, and we are talking about the sacroiliac joint, or this joint that, in my opinion, gets overdiagnosed as the reason for low back pain, especially pain that is across the belt line. There are a lot of structures in the area of the sacroiliac joint, like the L5-S1 facet joint, like the sacrotuberous and sacrospinous ligament, as well as some of the pelvic floor and deep hip muscles that can all refer to that same area. And so one exercise that we love to give patients who have low back pain is this transition between Cobra and Child's pose. And we love it because it forces us to mobilize a lot of different body parts: the lumbar spine, the sacrum, the ilium, the hip joint, and even some of the upper back and shoulders. And so I'll show you that exercise, but it is quite simple. You are going to start in a Cobra position, hands underneath the shoulders, shoulders out of the ears, belly and butt is completely relaxed in this position. And then you shift the weight back into your child's pose, where the hips shift back over top of the heels, bend the knees, arms reach out in front of you, and we're opening up through the hips and the pelvis in the low back. And then you'll just shift forward, dropping the hips down towards the floor, relaxing the belly and the bottom, shoulders out of the ears, arms are doing all the work. Then you engage those abdominals to lift right back, shifting your weight back over top of the heels, relaxing through the inner thighs, the head, the neck, the shoulders. You can try transitioning between those two movements 10 times, 20 times, however many feels good for your body on that particular day. The only people that I would not recommend that exercise for is anybody who's clearly just had a surgery, really kind of anywhere in their body, because it's kind of a full body movement, as well as somebody who has an acute herniated disc. They are typically not going to love this exercise. But if you are just struggling with non-specific low back pain, it is usually one that feels pretty good. And it'll at least help you identify what your preference is, whether it's flexion or extension. Let us know if you have any comments here, if this is something you've tried before and you've liked it. As always, we appreciate your shares and your subscription to our channel, as we release videos almost every week to try and help you learn how to feel better in your body. Have a wonderful day.